Welcome to this crash course video on left-sided heart failure, also known to some as congestive heart failure. There are two types of heart failure, left and right-sided, but for this video, we'll focus only on left-sided heart failure. Today, we'll cover what left-sided heart failure is, its causes, the forward and backward pathophysiology of heart failure, signs and symptoms, and how it affects your organs. In addition, we'll cover the aspects of the head-to-toe assessment that should be performed when left-sided heart failure is suspected. In the end, we will cover two NCLEX-style questions on left-sided heart failure that will ensure your understanding of the material and guarantee you to get those questions right when it's your time to take the NCLEX.
The normal heart is a strong muscle, slightly larger than a fist, that continuously pumps blood to the body. The right atrium takes oxygen-depleted blood from the circulation and pumps it into the right ventricle, which then pushes the blood towards the lungs to become oxygenated. Once oxygenated, the blood enters the left atrium and then the left ventricle to be pushed into the circulatory system to give oxygen to tissues throughout the body. According to the American Heart Association, heart failure occurs when the heart isn't pumping as efficiently as it should be. The heart tries to make up for this deficiency in three ways. First, the heart hypertrophies or enlarges in an attempt to pump more blood. In addition, the heart develops more muscle mass as another attempt to pump more blood to the tissues. Lastly, the heart will pump faster as a last attempt at increasing oxygenation to the tissues. These adjustments to heart failure do not improve the condition. In fact, they can make matters worse as it continues to place more stress on the heart. These adjustments the body makes can mask heart failure, so it is important to recognize common signs and symptoms of heart failure to detect it early.
Some common conditions that can cause or lead to heart failure include ischemic heart disease, coronary artery disease, heart attack, cardiomyopathy, chronic hypertension or high blood pressure, faulty heart valves, myocarditis or inflammation of the heart muscle, congenital heart defects, arrhythmias or abnormal heart rhythms, and any sort of damage to the heart muscle including infection, heavy alcohol use, and drugs such as cocaine or some drugs using chemotherapy treatment. Risk increases with age, and heart failure occurs more often in African Americans than in Caucasians. A few other conditions known to cause heart failure include HIV, diabetes, overactive or underactive thyroid, and kidney conditions. Lastly, sleep apnea, smoking, or tobacco use, obesity, and some viruses are known to be risk factors for developing heart failure.
Now let's discuss the forward versus backwards effects of left-sided heart failure. In forward left-sided heart failure, the failing left ventricle, the one that pumps blood to the whole body, does not pump blood through the aorta as efficiently. This results in a decreased pressure in the aorta and subsequent drop in pressure in the arterial system. In layman's terms, your blood pressure drops. As a result of this significant drop in blood pressure, baroreceptors located in the walls of your arteries detect this drop and stimulate the sympathetic nervous system to increase the heart rate and promote vasoconstriction of the blood vessels. Both of these actions attempt to counteract the low blood pressure. However, the increase in heart rate further stresses out the already weakened left ventricle. Another consequence of the forward effects of left-sided heart failure is decreased perfusion or blood flow to the kidneys. Lack of blood flow to the kidneys stimulates the ROS system to release renin, which ultimately leads to an increase in blood volume and pressure. This again creates more resistance and pressure on the weakened left ventricle.
The renin-angiotensin-aldosterone system, or ROS for short, is a system that is stimulated by low blood pressure detected by the kidneys. Renin is released, which stimulates the conversion from angiotensinogen to angiotensin 1. Angiotensin 1 is converted to angiotensin 2 by ACE in the lungs. Angiotensin 2 is a potent vasoconstrictor and also stimulates the release of aldosterone. Aldosterone is secreted by the adrenal gland and acts to cause increased sodium and water absorption to increase blood volume and ultimately increase blood pressure. Constant stimulation of the ROS causes increased amounts of aldosterone. Constant stimulation of aldosterone can result in hypokalemia, or low potassium, putting you at risk for cardiac dysrhythmias.
Signs and symptoms of the forward effects of left-sided heart failure include weak peripheral pulses, cool and clammy extremities, and confusion and disorientation that result from decreased perfusion to the brain. The lower extremities may be swollen as fluid accumulates. Nocturia, or frequent urination at night, may also be present.
The backward effects of heart failure are a result of blood backing up from the left ventricle into the left atrium. The blood then backs up into the left pulmonary vein. Here, hydrostatic pressure overcomes osmotic pressure. The increased hydrostatic pressure overcomes the osmotic pressure, causing fluid to leave the extracellular space and collect in the lungs. Fluid buildup in the lungs hinders oxygen diffusion from the alveoli. The alveoli try to open and close against the fluid, and this is where crackles may be heard through the stethoscope.
Signs and symptoms of the backwards effects of left-sided heart failure may appear minimal at first. In particular, the client may have minimal symptoms at rest, but become short of breath upon exertion or with lying flat. The symptoms can also result in many pulmonary symptoms. This can include pulmonary edema or fluid buildup in the lungs, which can present with pink, frothy sputum and coarse crackles. You may experience orthopnea or shortness of breath while laying flat because of the fluid buildup in the lungs, causing pressure on the alveoli and hindering oxygen exchange in the lungs. A cough may be present. Lastly, paroxysmal nocturnal dyspnea may be present, which is sudden shortness of breath that happens in the middle of the night. This symptom awakens one from sleep and is often described as a nightmare or night terror. Other signs and symptoms of left-sided heart failure can include edema or swelling in the legs. The extremities may appear pale and cold due to decreased blood flow. Weight gain can occur as the body accumulates fluid.
If you go to the doctor and they suspect that you might be suffering from left-sided heart failure, there are a few assessments that you can expect them to do to confirm a diagnosis. First, they'll take your vital signs, emphasizing those that strongly relate to your cardiovascular system, such as heart rate and blood pressure. If the left side of your heart is failing, the decrease in cardiac output may cause your heart rate to increase above the normal rate of 60 to 100 beats per minute. The provider will also likely compare your apical pulse to your distal pulse to determine whether or not there is a pulse deficit. The provider will auscultate your heart sounds and should hear the normal S1 and S2 sounds. It is possible that they might hear an S3 or S4 sound. In the respiratory assessment, the provider will listen for abnormal lung sounds, such as wet or coarse crackles. This can indicate pulmonary edema. The provider will also test capillary refill by squeezing the tips of your index fingers and big toes for 5 seconds. It is expected that they will blanch, but their color will return in under 2 seconds. A prolonged refill time suggests poor circulation, which could be caused by the inability of the left ventricle to pump enough blood to the periphery. Poor circulation can also be shown with a skin assessment by inspecting and palpating the color and temperature of the skin, as well as for any signs of edema. It will feel cold and clammy with decreased circulation. The lips and fingers may appear blue, indicating cyanosis. Finally, they will likely check your neck for distension of the jugular vein. Jugular vein distension is a common sign of right-sided heart failure, so it's unlikely that they will see distension of the jugular vein in left-sided heart failure.
While left-sided heart failure will affect the heart, it also has systemic effects throughout the body. One main effect on the heart is left ventricle hypertrophy, as the muscles of the left ventricle grow due to the increased workload of pumping against resistance. This hypertrophy makes the left ventricle less efficient and doesn't actually lead to increased blood flow. Decreased blood flow throughout the body, and specifically the GI system, can lead to anorexia, nausea, and abdominal discomfort. Decreased perfusion also affects skeletal muscles, leading to weakness and exercise intolerance. The kidneys require a certain perfusion rate to maintain a normal urine output, so less blood flow through the kidneys will decrease urine output and cause filtration of the blood to be suboptimal. Finally, heart failure can also lead to liver damage, as increased fluid buildup can place extra pressure on the liver. The damage to the liver can appear as scarring and disrupts common functions of the liver.
The key to preventing heart failure is to reduce your risk factors. Controlling these risk factors usually can be done by making healthy lifestyle changes and routinely taking medications prescribed by your provider. This can include smoking and alcohol cessation, controlling other conditions such as diabetes, high cholesterol, and high blood pressure, staying physically active, eating a balanced diet that is low sodium, low fat, low cholesterol, maintaining a healthy weight, and reducing and managing stress. If you experience new or changing symptoms or side effects from your prescribed medications, make sure to see your provider about your condition. It is important to get regular checkups to improve your signs and symptoms and overall quality of life.
Now we're going to go over 2 NCLEX style questions and explanations of the correct and incorrect answers. Number 1. A patient was recently diagnosed with left-sided heart failure and you are providing teaching. Which of the following statements made by the patient indicates an understanding of the teaching? Select all that apply. A. I will make sure to weigh myself daily. B. I should lay flat in bed to help with breathing. C. I should receive counseling on smoking cessation. D. I will take my medications as prescribed. And E. I do not have to adjust my salt intake. I'll give you a second to pick which answers are correct. A is correct because heart failure can cause fluid to accumulate, especially in the lungs, as pulmonary edema. Obtaining a daily weight will allow the patient to monitor potential fluid buildup. B is incorrect because laying flat can exacerbate the dyspnea often experienced as a backward effect of left-sided heart failure. Fowler's or a seated position is usually more comfortable for the patient and it allows for easier breathing. C is correct because smoking is a primary factor in heart disease and smoking cessation could improve the patient's health outcomes. D is correct because it is important that all patients take their medications as prescribed. Heart failure is a serious disease, but outcomes are significantly improved with the correct drug regimen. If they want to discontinue a medication for some reason, they would need to discuss that with their provider. E is incorrect because salt intake can contribute to hypertension, which will worsen the patient's heart failure. They will likely need to incorporate many lifestyle changes, and adjusting their salt intake will probably be one of them. Time for the second question. Which of the following are not signs and symptoms of left-sided heart failure? Select all that apply. A. Weight gain. B. Jugular vein distension. C. Persistent cough. D. Crackles. And E. Ascites. I'll give you a second to pick the right answers. A is incorrect because weight gain is a side effect of left-sided heart failure due to fluid buildup as blood that is not pumped through the aorta backs up. That backup of blood will accumulate in the lungs, causing a cough and crackles upon auscultation, so C and D are also incorrect. B is correct because jugular vein distension is a common sign of right-sided heart failure, not left-sided. Ascites, especially in the legs, is another sign of right-sided heart failure, so E is also correct.